Good morning, dear colleagues. My name is Dr. Laurent Garderet. I work in Paris at Sorbonne University in Pitié Hospital, Pitié-Salpêtrière Hospital. I'm going to talk briefly today on a prospective observational study that we conducted with the French Society of Transplantation and Cellular Therapy, SFJMTC. The question is it safe to perform autologous stem cell transplantation in myeloma patients with a renal insufficiency? So we enrolled 47 patients so far. These are newly diagnosed myeloma patients with a renal failure, a creatinine clearance of less than 40 milliliter per minute at the time of transplantation. And the primary endpoint is transplantation-related mortality. So what we observed, I must say first that the conditioning, the induction regimen was Velcade-based, mostly VCD, VRD, and VTD. And the patients got melphalan 140 milligram per meter square, followed by autologous stem cell transplantation. So what we observed at day 100 is one toxic death secondary to a septic shock among the 47 patients. No other patients went into intensive care unit, and we didn't observe any additional death. In terms of hematological recovery, it was 12 days, both for the platelets and the neutrophils in median, and the median duration of hospitalization was 21 days. In terms of efficacy, at day 100, 50% improved their hematological response, with 87% of patients reaching at least VGPR 100 days post-transplantation. In terms of renal efficacy, at 3 months post-transplant, we observed an improvement of renal function in more than a third of the patients. No patients worsened their renal function. Some patients were on dialysis, 13 at diagnosis, 6 at the time of transplant, and 4 3 months post-transplant. So in conclusion, in this preliminary analysis, for these maybe of selected patients, we believe that the toxicity is acceptable, and the efficacy, both in terms of hematological and renal efficacy, interesting. So it could be that indeed it is safe nowadays to perform autologous stem cell transplantation to patients with severe renal insufficiency at the time of transplant, even if the patients are on dialysis. Thank you very much for your attention.